Hello, my team and I will be speaking on the topic combination therapy in the treatment of malaria. Combination therapy is the use of one or more drugs with different mechanisms of action to treat a single disease. Combination therapy has emerged as a vital approach in the treatment of malaria, primarily due to its efficacy in combating the disease and reducing the risk of drug resistance. Single drug treatment or monotherapies has historically faced challenges due to the rapid emergence of the resistant strain of Plasmodium, a parasite responsible for malaria. One of the most successful combination therapy in the treatment of malaria is artemether and mefloquine. Others may include artesunate and mefloquine, artesunate and amodiaquine, dihydroartemisinin and piperaquine, azithromycin and chloroquine, and others. Now let's dive into the mechanism of action. Artemether and mefloquine. Artemether is said to involve in the generation of reactive oxygen species. This happens when it enters into the parasite's infected red blood cell. It interacts with the hem, a byproduct of the hemoglobin produced by the parasite. This interaction leads to the generation of free radicals and reactive oxygen species, which is highly toxic to the parasite, leading to its death. Now, the mefloquine, on the other hand, has a slower onset of action and a longer half-life, and it is believed to involve in interfering with the detoxification process of heme, which is essential for the survival of the parasite.
Taking the mechanism of action of artesunate, amodiaquine, and dihydroartemisinin and piperaquine. Artesunate, which is a derivative of artemisinin, is rapidly metabolized into its active component, dihydroartemisinin. Artesunate is active against the blood stage and the lymphocyte level of Plasmodium species. Artesunate contains an endoperoxide bleach, which is activated by heme ion, which causes oxidative stress in the parasite, thereby decreasing the growth and survival of the parasite. Amodiaquine functions by Amodiaquine functions by interfering with the heme polymerase activity, thereby accumulating in the parasite and interfering with the formation of hemozoid in the parasite. Dihydroartemisinin, on the other hand, functions by cleaving to the endoperoxide bridge by ion, forming free radicals and damaging biological micromolecules in the parasite, thereby causing oxidative stress in the parasite cell. Piperaquine functions by accumulating in the parasite's digestive vacuole, thereby interfering with the detoxification of heme into hemozoid, and hemozoid is a very vital component for the survival and growth of the parasite.
In addition with what my colleagues have said, I'll be taking the last two malaria combinations, which are artesunate and mefloquine and azithromycin and chloroquine. Now, for the mechanism of artesunate, when artesunate is taken, it is being metabolized to its active form, dihydroartemisinin. Now, this dihydroartemisinin has an endoperoxidase bridge. When mosquito bites an individual, it injects plasmodium parasite into the individual. This plasmodium parasite digests the hemoglobin into the heme part and the globin part. The globin part is used by this parasite for its nutrition, while the heme part, which is toxic, interacts with this endoperoxidase bridge. When it interacts with the endoperoxidase bridge, it will now produce very reactive oxygen species. Reactive oxygen species produced will cause inhibition of protein synthesis and as well causes destabilization of the parasite membrane, leading to the lysis of the parasite membrane. So going on to the mefloquine. Mefloquine has similar mechanism of action with what? Chloroquine. The heme part of the hemoglobin produced by the parasite is very toxic to this parasite, and because of that, the parasite converts this toxic heme to non-toxic form, which is hemazoin, by the action of heme polymerase. So now, if this heme is very toxic and it has been converted to a non-toxic part, what this mefloquine does is that it binds to the ATS ribosomal subunit, causing or inhibiting the conversion of heme, which is toxic, to the non-toxic form.
So taking over from where my colleague stops, I'm here to talk about the rationale behind these combinations. I feel like one of the important things to get behind combinations of drugs are the obvious advantage combinations have over monotherapy treatments. So a few examples of combination therapy of malaria drugs are the artemether lumefantrine, there's the artesunate amodiaquine, there's the artesunate mefloquine, then there's the azithromycin and the chloroquine and so much more. Then, taking for instance the artemether and the lumefantrine. The artemether, the drug on its own is changed to its active metabolite, which is the dihydroartemisinin, and is used in the erythrocytic stages of plasmodium falciparum to inhibit its nucleic acid and protein synthesis. So the artemether is used in combination with the lumefantrine, which is a longer acting drug that reduces resistance and eliminates any residual parasites. Then the general aim of any and all combinations of these drugs are: number one, getting two combinations of drugs that have different molecular targets and reduce reemergence or resistance, and getting the second general aim can be getting a rapid acting drug and a longer acting partner in order to reduce resistance.
Okay, I'll be taking over from my colleague and I'll be speaking on the factors that govern the selection of choosing one combination over another. It's influenced by one, if there's a clinical need. For there to be a clinical need means that the individual has to be sick, or maybe there is a need that needs to be balanced in the body. Then the second option is if the combination provides a synergistic or additive effect, in the sense that the combination of these two drugs should either improve the performance of one over the other or increase its total performance. The third one is the efficacy obtained is greater than the individual component at same dose. That is, the when you combine these two drugs, the efficacy that they are giving should be greater compared to when you give them individually. Then the fourth one is the clinical photon is the overall effect on the dose and those related side effects. The overall effect on the dose is saying that the effect on the dose should not be too high that the side effects will be higher. It's just saying that the effect on the dose should be normalized so that it will produce the desired therapeutic effect. That's the desired good effect in the body. Then the cost of combining two drugs. The cost of combining two drugs can actually influence the choice of a drug combination and the influence on patient compliance. There are some combinations that when you combine them together, it helps to, maybe the second combination will help to reduce a side effect that one combination has, maybe in effect of bitter taste. Another drug which combines with it might cover that bitter taste of the second drug, making it more easy for the patient to take the drug. Then the ability to overcome the issue of resistance in the case of anti-cancer drug and antibiotics. So comparing these combinations such as acetaminophen, artemether-lumefantrine and artesunate amodiaquine. Artemether-lumefantrine is mostly used in regions where there is high prevalence of resistant strains. But these two combinations can also be used because they are safe and have high tolerance rates, that the body tolerates it. Then comparing dihydroartemisinin piperaquine with artesunate and mefloquine. These drugs, when they are combined together, they have high efficacy. Also, in their dosage regimen, the dihydroartemisinin piperaquine is taken once daily for 3 days, while artesunate mefloquine is also taken once daily for 3 days. Then combining artesunate mefloquine and azithromycin chloroquine. The drug, which is artesunate mefloquine, is mostly used for treatment of infections, while the other is used in treatment of mostly the case of resistant strains. And this combination gives a cheaper rate when purchasing them.
I'm talking about the comparison of various combinations of anti-malaria. First is the artemether lumefantrine combination, which contains 80 mg of artemether and 480 mg of lumefantrine, taken twice daily for 3 days. It is very effective and it's well tolerated. The second is the dihydroartemisinin piperaquine combination. It contains 40 mg of dihydroartemisinin and 320 mg of piperaquine. It's taken 3 tablets for 3 days. The third combination is the artesunate amodiaquine combination, which contains 4 mg per kg of artesunate taken daily and 10 mg per kg of amodiaquine taken daily for 3 days. It has cure rates of 90 to 95% and associated with side effects such as nausea and vomiting. The fourth combination is the artesunate mefloquine combination. The artesunate is taken 4 mg per kg daily, and then the mefloquine is taken 15 mg per kg on the second day and 10 mg per kg on the third day. Cure rates are 90 to 95%, and it is associated with side effects such as dizziness, nausea, and then neuropsychiatric effects also. The fifth combination is the azithromycin chloroquine combination, which has 500 mg of azithromycin and then 10 mg per kg of chloroquine taken on the first and the second day, and then 5 mg per kg of chloroquine taken on the third day. It is associated with side effects such as GIT symptoms, itching, and it is taken daily for 3 days. It is very, very effective. Now, talking about cost, most ACT drugs cost around $1 to $2 per treatment, and artesunate mefloquine is slightly more expensive than others. Thank you for listening.